natural. Something wrong. I'm not really the brightest. I've been a nurse practitioner for over 40 years. I'm old, and some of you weren't born yet when I started. So that's all right. I know a lot more than you with my aging. All right. So this is on breast health, right? Why are we doing breast health at this optimum time? Do you know?
And it's very important. How many people here have had the HPV vaccine? Show of hands. If you haven't, you should. Basically.
They don't know. They have to ask their mommy and daddy and look at their immunization. My granddaughters don't know what they have.
Segue to my next question. Are there any vaccines for like adult children that they should take a booster or?
Oh yeah, certainly.
I'm talking about like college age.
Like tetanus, for instance. They put tetanus every 10 years.
Yeah.
For instance. So yes, yeah. And as you get older, things like RSV and the flu vaccine, you should be getting that. COVID vaccine boosters. Yes, sure.
Especially if you have illnesses like diabetes and high blood pressure, you should really do that RSV and other vaccines recommended by your doctor. You should really follow up. Okay? I know.
It's a disease of children. We started at 2 months of age, for instance, and they get a little series, and then older people are susceptible to RSV as well, over 50, 60, or people with certain underlying
Is that
problems.
just one shot or like series of shots?
Suckling your young. Men are not preparing for that. But sometimes they can have a little discharge from their nipples depending. Men have hormones too. And if one hormone gets a little higher or for some other reason, if there's a lump there or something underneath, you know, you can have a little nipple discharge. So please feel your breast for lumps. You don't have periods, so pick a time every month. All right? So men do.
That doctor is usually giving you guidance as you get older. I practice that's in medicine, and all my patients, we talk about sexuality and these sorts of health issues, and alcohol, drugs, sex. And so you should have that rapport with your clinician, so that this isn't coming from that field, and you should be going for physicals on an annual basis or every 2 years at least. So you should have that contact with your doctor, and that rapport that kind of helps you make those decisions. And certainly, if you don't have that relationship at the moment, you should make sure that you go for regular checkups. We teach our patients on breast self-examination, for instance, and the men testicular self-examination. And it's very important to have that contact with the clinician. So just remember that. And HPV, by the way, is the commonest cause of cancer of the cervix throughout the whole world.
Beautiful, and especially with your hair. But I've done research on hair products, on skin products, and most of them have chemicals. And it's the chemicals that destroy your hair and your skin. When you're young, it's not a problem, but as you get older and the skin cannot bounce back, then you start using these aging or anti-aging stuff. Anti-aging is chemicals. And we know that chemicals will destroy your body. So make sure when you purchase a product, read the ingredients first. Not only read it, but analyze it.
SPF products.
SPF, like sunscreen.
Sunscreen products.
I'm not going to specialize any products, but I'm telling you that read the ingredients, analyze the ingredients, and you'll go from there. Sometimes you buy things by brand names because somebody bought it and it makes them look good. The label.
Right, but sometimes like, like we're not scientists like you and Dr. Perry and, like some things I don't even understand what it is. Like in the label. So like what are things?
Right, that's why I told you to analyze it. The skincare products must have the generic names and sometimes the...
For black women, usually you like wearing braids and stuff like that. You said to be careful what you're wearing in your hair. So what would you recommend us to look for in a, like, let's say dye hair, it's not mine, obviously wax. So what would you recommend us to look for in a product?
Natural products, plant-based products. and not all plant-based products either. That's why I say you have to analyze them.
Because
You're
usually,
smart.
usually they don't put the thing they like they do the hair, let's say the braid, they don't put what they use to do that thing. So
There are 1 zillion hair care